Looking now at dental implants, which is chapter 53 in your book, and now that you've had a chance to learn about and have an understanding of what removable prosthodontics is, what it consists of, how it's allowed to stay in the mouth, and also looking at fixed prosthodontics and understanding what it is, what is an indirect restoration, what makes it an indirect restoration, and also what that process looks like and how it gets cemented or bonded into place to make it more fixed or permanent. Well, dental implants is now becoming a little bit more standard of care when it comes to providing options to patients when they're being treatment planned. Before, when implants first came out, people were still unsure about them. They were very costly, and oftentimes insurance would not pay. They've since evolved a lot since then, and oftentimes you might get a much better result doing an implant than doing something removable or fixed. So it's definitely something that more patients are going to be inclined to do. And because now they have such a high percentage rate of success, upwards of 90% when it comes to dental implants, which can often be more than a fixed prosthesis or even a removable. And also they have a tendency to last a lot longer if they're done correctly. This is probably an area where the saying is true, you get what you pay for. If you're going to pay cheap, then oftentimes you're going to end up with a result that's going to be not very good. And in the long run, you're probably going to end up paying more to fix what was done as a result of trying to save money. When it comes to implants, this is an area that you, again, don't want to go cheap with. So implants, what are they? What does it consist of? Well, it depends. There's going to be different types of implants that are going to be available. And as with anything, there's going to be pros and cons that come with it. And same thing is going to be true whether it's removable or whether it's fixed. There's always going to be pros and cons with anything that we're going to be doing in dentistry. And it's all going to depend on the person themselves and whether or not they're going to be a good candidate for this type of recommendation. So first type of dental implant that we have is something called an endosteal, and this is something that's kind of like the tomato. You might hear it mentioned as endosteal or endosteal. So again, either one is correct. It's just going to depend, just like tomato. So an endosteal type of implant is surgically placed, and that's going to be true with all types of implants. Implants are going to be a lot more invasive in that it's going to require surgical placement of these prostheses. So with an endosteal type of implant, what it does is it's going to replace basically the tooth structure. So it's going to act as the root of the tooth. The endosteal implant can either be a blade, it can be a cylinder, or it can look like this one, which looks like a screw. This is a screw type of implant, endosteal implant. Endosteal implants are done usually in 3 appointments. The implant is surgically placed into the bone. It allows for osseointegration, which usually takes anywhere from 3 to 6 months for that to occur. And osseointegration is where the natural bone basically adheres to or attaches to the implant. We want to make sure that that has taken place before we start to build something that's going to go on top of it, again, because we want it to be able to provide some strength and stability. So this would be what an endosteal implant would look like if it were placed in the gum tissue. And once that first appointment takes place and the osseointegration occurs 3 to 6 months later, what they'll do is they'll get the patient back in and they'll expose the implant by removing the tissue over the top of it. And then they start the creation, the fabrication of in this case, a crown. The crown would then get made and then it gets inserted into the implant. And depending on the type of implant, it could either be screwed in or it gets cemented in, which is again going to provide a little bit more stability to that. But what this does is having an implant, even though this may get cemented in just like a normal crown would, with this one, we're not having to replace let me put these already back on here so you can see. It would not require the need for us to mess with the adjacent teeth due to that missing tooth. So unlike a bridge that would require us to reduce the two adjacent teeth next to the missing tooth, if these teeth were perfectly fine, nothing wrong with them, there were no prior restorations done, that would be hard to do because you're taking away natural tooth structure to accommodate something to fit over the top of it. This is where an implant would be a much better option for a patient because they're not having to cause trauma or reduce the adjacent teeth that don't need it. So this is where the implant would work very nicely. Oftentimes while the healing is occurring, the flipper, this is where the flipper might come into play. They're going to create some sort of an appliance so that the patient has the appearance of a tooth while the patient is waiting to get their permanent restoration done. So this is what an endosteal type of implant would look like. Again, it acts as the root of the tooth, providing a little bit more strength and stability, plus it's maintaining the integrity of the bone around it. Another type of endosteal type of implant would be for a denture, and this is actually for an upper denture. And you can see that a few implants have been placed strategically around the mouth. There's been 6 implants that have been placed. We have 2 on this side, which would be right in the vicinity of where the premolars would primarily be. We have 2 here on either side where the canines would be. And then we have 2 on the other side where, again, close to the premolar region where premolars would be. And this one actually has a bar that is attached to the implants. Even the way the denture is made, this is an upper denture, and it's made very similarly to how a mandibular denture would be in that it's horseshoe shaped. Unlike a traditional denture that would have the palate here, this is going to be much more comfortable for the patient. The fit is going to be much better, and they're going to be able to actually taste their food much better than having that something covering their palate. So what this does is once you line it up, you snap it into place, and it's very, very sturdy. I'm really applying a lot of pressure on this denture, and it's not coming out of the mouth. So what's nice about this is the patient has that extra satisfaction or knowing that this isn't going to fall out of their mouth every time they try to talk, or if they were to sneeze, they don't have to have some sort of adhesive to help hold this in place because due to the implants, it's providing a lot of strength and stability. They can really be able to chew and function much more appropriately and better than they could be with a traditional denture. That is why this is very good. This implant supported denture is ideal, especially when it comes to the mandibular teeth, because oftentimes that's referred to, as I've mentioned before, the floating denture, because it just sits on top of the tissue, and if there's not enough ridge there to help hold it in place to provide retention, it's going to move around. So an implant retained denture is going to be much better and provide that stability and support and that retention that the patient is not going to get by having a traditional type of denture. So that would be the endosteal, where it sort of replaces the tooth. Sorry, my dogs are barking. Next is going to be the subperiosteal implant, and the subperiosteal, because usually done in 2 appointments, the alveolar ridge is exposed. Impression is taken in order for this appliance, this implant, to be created at the lab. Once they get it back from the lab, they re-expose that alveolar ridge and they place it, and it sits right on top of the bone. And then they cover it back up with the tissue, with the posts sticking out of the gum tissue. And again, this is going to be suggested for a patient that has a substantial some alveolar ridge loss, either due to long-term denture wear, but it's going to, again, provide a little bit more stability to the denture. Sits on top of the bone, subperiosteal, meaning it's below the periosteum, the attached connective tissue that's there, and it sits on the bone, still allows for retention. The next type is a transosteal, may also be referred as transosteal implant, and it's often called a staple bone implant because of how it's designed. It actually gets implanted into or surgically placed into the bone. It would be down here, the bottom portion of the border of the mandible down here. It actually gets attached to that. And this is going to be suggested or recommended for those patients that have pretty severe loss of ridge. There's just pretty much nothing there. It's almost flat. This is what's going to have to be placed in there along with some bone grafting to allow for something to fit over the top of it. Another type of implant is going to be a mini implant. Don't have a picture of that, but it somewhat resembles kind of like a nail. It's very, very thin and skinny, and it doesn't require extensive placement, and those are oftentimes an alternative as well. Those are going to be for patients who have a pretty good ridge, pretty dense bone that's going to be present in order to accommodate that mini implant. Other thing with implants, it still requires maintenance, still requires home care to be pretty good, still requires the patient to come in, and that's going to be the case with any type of prosthesis that's going to be created, whether that's a removable appliance, the patient is still going to have to clean it and maintain it. If it's a fixed prosthesis, patient is still going to have to maintain it and clean it, as well as going in for periodic cleanings, and same thing with the implant. With the implant, when it comes to cleaning, special instruments have to be used. You can't use metal instruments when it comes to titanium or metal implants. It has to be either nylon or plastic coated, and that's again so that it doesn't scratch or damage the implant. So this is implants in a nutshell.